Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you. Welcome to this edition of Pregnancy to Parenting. I'm Hawa Solomon, and shukran so much for joining us as we chat today about your premature baby. All the premies, anything you need to know, questions that has been asked on our Facebook page and that we've received some interest on. So please do add them on our Facebook page, which is Pregnancy to Parenting. Your comments, questions and queries, definitely will add them as well to our production and be possible content on Pregnancy to Parenting. Today we are very pleased to welcome to you again Dr. Rabin Lachman, a pediatrician based out here in Cape Town in Rondebosch at Rondebosch Medical Center, and he will be chatting to us about all that you need to know about prem babies. A very good day to you, and thank you so much for joining us once again.
Good day, Hoa, and it's nice to be back.
Yeah, thanks so much again. So today, as we discovered and when we were chatting the last time around about your newborn,
yes,
realizing that the feature with regards to a premature baby is on its own.
Yes.
And the information that we need to know about it. So firstly, explain to us the word premature baby. What does that term mean in both medical and layman explanation?
Yes, I think it's very important to understand the terminology. So a normal pregnancy goes up to about 40 weeks. We call that a normal term pregnancy. Mm-hmm. So any delivery that occurs before 38 weeks of pregnancy mm-hmm. is termed a preterm delivery. And anything after 42 weeks is termed a post-term delivery. Okay. So a term pregnancy is anything between 38 and 42 weeks. So preterm, before 38 weeks. Okay. So when a baby is born preterm, that means before 38 completed weeks of pregnancy, we then further divide it into what is called a low birth weight baby, mm-hmm. if the baby's weight is below 2.5 kilograms, and a very low birth weight baby would be less than 1.5 kilograms, and an ultra low birth weight baby would be less than 1 kilogram.
Okay, so we have on screen a premature baby, the preterm baby, a term baby, and I think a pre-prem baby or premature baby, and that would be all categorized according to
their
the
weight,
duration and the weight.
Yes.
Okay.
So in general, preterm baby below 38 completed weeks of pregnancy.
Okay, so, and then what do you guys call it medically? Is it called premature?
Preterm baby, yes, okay. A preterm baby, and then we further classify it, as I've mentioned, according to the weight.
Okay, all right. So looking at the growth of premature births rising, let's talk about the common factors associated with premature birth.
Yes. So the reasons for premature babies can be divided into maternal reasons mm-hmm. or fetal reasons, meaning for the baby reasons. So a premature birth can be due to a maternal illness, for example, okay. that where the continuation of the pregnancy results in danger to the mum's life or is harmful to the mum. Mm. So there are various medical conditions such as hypertension in pregnancy, which would result in a baby being born premature because the mum's blood pressure is not under control. So there are various medical reasons that affect the mum that would result in a baby being born premature. And at the same time, there are certain conditions where we see that the baby is not growing well, or there are baby conditions that will result in the baby being born earlier. So when a baby is born premature, it can either be an elective premature delivery, where your gynecologist will tell you, okay, it's really dangerous to proceed with the pregnancy any further than this, and I would suggest that we deliver the baby at, say, for example, 34 weeks, or that your blood pressure is really uncontrolled at this time and it is really dangerous to the mum's life and we need to deliver this baby urgently, okay, in order to save both the mum's life and the baby's life. From the baby's perspective, the baby can have poor growth, the baby can have inadequate blood supply, or can go into what we call fetal distress, where the baby is not getting enough oxygen, and that would result in the baby being born early. So that is sort of elective deliveries.
Okay. For medical reasons.
Yeah, for medical reasons. And an emergency premature delivery is when a mum goes into spontaneous preterm labor for some or other reason, either it be an infection or it's just a spontaneous rupture of membranes, and then goes into preterm labor.
On that point, is it ever associated to stress and the environment? And because I've read a bit about that as well.
So there is some evidence that stress and a high stressful job and a very stressful lifestyle and overactivity during your pregnancy is associated with preterm labor.
Okay, so moms in every aspect, take it easy and take care. All right, so let's look at what mom and her support base can do, you know, to kind of minimize all of that, whether it be stress, whether it be medical, and also just with the help of the gynae advice. What can they do?
So what's very important is good antenatal care. Okay, so it is very important that when mums realize that they are pregnant, to what we call book early with a gynecologist or with an antenatal clinic, so that they can be followed up regularly, so that if they do have any medical conditions, these conditions are picked up early and appropriately managed. And if they do have any conditions, that they are regularly followed up, and that, you know, the baby's growth and weight gain is properly monitored and checked, and that you know, anything that can be picked up early will be early identified and acted on in good time.
Okay, so if this does occur, what is the role of the pediatrician and other specialists involved in this birthing process?
Okay, so in the birthing process, just to explain, you know, when you are going into labor or going to have a delivery, if you are having a cesarean section, there are 3 specialists that are usually involved. It is the anaesthetist, it is your gynecologist, and it is the pediatrician. So the anaesthetist pays attention to your pain control during the Caesar. The gynecologist performs the operation and performs the cesarean section, and then hands the baby to the pediatrician. Once the baby is out of the womb and in our world, then the pediatrician is responsible for the baby's care thereafter. And thereafter will be the main doctor or main specialist looking after the baby.
Okay, and who is that?
The pediatrician.
The pediatrician.
Yes.
Are there any other specialists involved? Because I've heard of neonatologists.
Yes. So a neonatologist is a specialist pediatrician. So a pediatrician that has super specialized in neonatology and is only focused on neonatology, and that is mainly premature deliveries. But a general pediatrician should be able to manage a preterm baby as well.
What happens next? Because after the birth and the scary bit of knowing that you're going into early labor, or you've had the elective cesareans medically, of course, the reasons given. Talk to us about when baby leaves and now mommy is also now gone.
Okay, so depending on how premature the baby is, that would determine what complications would arise from the premature delivery. So immediately after delivery, the baby will be attended to by the pediatrician at the delivery. The baby will be assessed by the pediatrician, and if needed to be resuscitated, will be resuscitated. The next main thing to manage is the baby's temperature. A premature baby does not maintain his temperature, and therefore it is very important to keep the baby at an adequate temperature. So the baby will be maintained in an overhead heater or put into a closed incubator to maintain his temperature. And then, depending on the amount of support that baby needs, the baby will be then admitted to the neonatal ICU and taken further from there.
Okay, this is a very scary bit for moms, because often they don't see babies after that, as the other moms see babies being trolleyed into their rooms and stuff. So the emotions around mommy quickly.
Yes, so the emotions are quite high, especially if it was unexpected or an emergency delivery. So baby will be admitted to the neonatal ICU and stabilized there. So obviously is not mobile. And depending on the mode of delivery of the mum, it will be decided whether she's mobile or not to go to the neonatal ICU. If it is a normal or natural delivery, within 6 hours the mum should be mobile and can walk across or be pushed in a wheelchair to go and be with her baby. Unfortunately, this is a little bit longer with a cesarean delivery, where the mum is a little bit more immobile and will most probably then see the baby within the next 12 or 24 hours.
I think the big question also comes with prim babies being in ICU is how long are they going to stay in hospital?
Yes. So again, it depends how premature the baby is and what complications they experience. So and how much of support do they need. That will determine how long the baby will stay in hospital. Remember, a baby that's born at 28 weeks is quite premature and will be in hospital for quite some time before he can go home, approximately about 2 to 3 months. Remember, that was the amount of time that baby was supposed to still be in the womb, and we are creating this sort of environment in the hospital to support the baby with regard to oxygenation, feeds, etc. And until the baby is able to manage on his or her own self, will be then able to go home.
So it's as if baby still needs to be kept in the room in that safe place. So plus minus, that's how you should work it out.
That's plus minus how you should work it out.
Thank you so much, Dr. Lachman. We'll take a short break and come back with more on your premature baby. Stay with us. Welcome back to Pregnancy. This is Pregnancy to Parenting. Welcome back. And I'm Hawa Solomon. Shukran so much for joining us and staying with us. We're chatting about your premature baby. If you've had experience with a prim baby, I know you look at it, it's a very delicate situation to be, going through this process. Please do interact with us and tell us your story on the Pregnancy to Parenting a Facebook page rather. In studio we have Dr. Rabin Lachman, pediatrician based at the Rondebosch Medical Center here in Cape Town. Thank you so much for joining us once again. We discussed what premature baby is, how it happens, what happens with baby when he or she is just born. And just before the break, you were talking about the process of how long baby is staying in hospital. So understanding that if you were 28 weeks or 32 weeks, in fact, that week still when you were supposed to be carrying baby to term is the duration you should be thinking of, plus minus. So where baby's first home is after birth, you've mentioned the neonatal ICU. Just explain to us what happens in the neonatal ICU.
Yes, the neonatal ICU, it can be quite a scary place for a new mum, and mums are often taken aback after they see their baby connected to all sorts of wires and monitors. So what happens in the neonatal ICU after the baby is born depends on the amount of support and the complications that the baby has. So first of all, I've mentioned keeping the temperature at an adequate temperature for the baby. And the baby will be admitted to the ICU either on an overhead radiant heater or a closed incubator. So depending on how much support he needs, if he needs a lot of support and a lot of machines, then he will be on an open incubator. If he does not require too much support, then he will be in a closed incubator. Then if the baby requires respiratory support, so a premature baby, one of the main systems that requires support is the respiratory system, and this is because the lungs are the last system to mature, the last system to mature, and the lungs are usually mature at around 34 weeks of gestation. So when a baby is born premature, they usually need some sort of respiratory support. And this support can either be in the form of nasal prongs oxygen, where it is just a cannula, or we give them what is called CPAP, continuous positive airway pressure, and this is provided in the nose through a CPAP driver connected to a machine to support the baby's breathing. If the baby was not breathing or is breathing inadequately, very shallow breathing, then the baby may need to be intubated and placed on a ventilator. That is when a tube is placed through the nose into the lung, and that tube is connected to a ventilator. So we see that more commonly in the very preterm babies, so around the 28th gestation week, where they need, ventilatory support. So we look at that, the respiratory support, and then we give them feeding support. So they will either be connected to an IV line, where they will have a drip put up, or a nasogastric tube put through the nose down into the gut. And that is where they will receive their nutrition from. They will have monitors on their skin that are connected to the chest, and this allows for an ECG monitoring of the heart rate, and then they will have what is called a SATS monitor connected to their fingertip or their foot, which is monitoring the oxygenation level of the baby. Depending on how sick the baby is and how premature, there might be other catheters and tubes put into the baby, like an umbilical cord, an umbilical vein. We use an umbilical catheter in it, or and if we need to monitor the urine, then a urine catheter as well.
So lots of wires and tubes connected to baby, and it can be quite scary.
It can be quite scary, yes, especially if the child is very premature and is very unstable.
Okay, you've mentioned a few of the tubes and the wires attached to baby.
Yes.
So and some of the special lighting. So just take us through it again. Yes.
Okay. So first of all, from the respiratory support, they can either have nasal prongs or a CPAP machine, which is connected to a CPAP driver. Okay. From a feeding point of view, they can have a nasogastric tube put in, or a IV line inserted to provide them with IV fluids. Then there are monitors on the chest, which allow for ECG monitoring, heart rate monitoring, and a SATS monitor that is connected to the
we've got a picture of the
CPAP driver. Yes, that's a picture of the CPAP driver.
Okay, and to the feet even. And
yes, so sometimes if we cannot connect the SATS monitor to the finger, then we will connect it to the foot to monitor the oxygenation level of the baby. If we cannot get a drip up on the hands, we will try the feet. Sometimes we even try the scalp to get a drip up. So all of this can be quite daunting to a new mom.
Yeah, something that interests me though is that this baby is so tiny, and they put them in this huge incubator, and lighting is sometimes used to warm the baby up immediately. I know even sometimes with those term babies as well.
Yes.
But the cap, this very interesting knitted cap that the neonatal sisters put on for the little one. How important is that, and why do they always do that?
So it depends. There's a special cap that is put on for the CPAP machines, which because the CPAP machine needs to be connected to the head. And there's lots of tubes that are going around the neck, so they made these special caps which allow for the tubing to go through, and connect and be kept in a stable position.
Okay, so it's not just the fact that
it's not just warm.
Okay, because it's nice and warm in there.
Yes.
Yeah.
A cap is very important to a newborn baby because the surface area of the head compared to the rest of the body is quite significant, and the baby can lose quite a significant amount of heat through the scalp. So a cap is very important to maintain temperature in a newborn baby.
So what we've often seen in the ICU is kangaroo mother care. I've decided to say kangaroo care.
Yes.
So I've seen lots of dads sit there and mother their babies. So kangaroo care is something that also helps. Please explain how it is done correctly.
Okay.
What is it? What is it exactly?
Yes. So kangaroo mother care originated in third world countries and poverty-stricken areas where they needed to transfer premature babies from a rural setting to a district setting where the child could receive adequate care. And what it was found was during that transport where they did not have incubators to transport the babies, they found it best to put the baby on the mother's chest, skin to skin, and cover the baby and transport the baby that way. And in that way, the mother's temperature kept the baby warm, and the baby got to the district hospitals in a much more stable condition. So that was the origination of kangaroo mother care. And after that, it was shown various benefits of kangaroo mother care, having the baby skin to skin on the mother or the father, and this allowing a safe environment to promote growth and well-being of the baby. When the baby lies skin to skin on the mother's chest, the baby feels safe. He feels the warmth of the mum. The warmth of the mum creates this environment that promotes growth and development. The baby gets used to the mother's scent and smell, and the baby listens to the mother's heart rate or heartbeat, a very familiar sound which kept them very entertained during their time in the womb. So that sound of the heartbeat is a very familiar sound to them, and thus this environment is a very familiar environment to them. So there's various studies that have done to show that this actually very much promotes premature growth and development and weight gain. And where we do not have facilities for numerous incubators for these babies, or where they don't need to be in an incubator, then the best place to be is in kangaroo mother care.
I've heard of a miraculous story. In fact, I think it was streaming the internet and YouTube recently, where this baby was born, and it was clinically proven this baby was dead, premature birth as well. And of course the mom and the dad was distraught, and they insisted on keeping the baby just to say goodbye. And they kept the baby on the mommy's bare chest. Dad was still lying next to it, and within minutes the baby's heart started to beat again.
Wow, that's very
it was rather miraculous. And then they even went to tell the nurse, please go and call the doctor.
Yes.
But the doctor refused to come. He said, no, listen, it was maybe 10 minutes ago I proved this baby sanctioned and medically dead. And
yes, that is quite a miracle.
And it was amazing. She said, no, and they had to go back and forth just to tell the doctor, no, we've accepted that the baby's dying. We actually were saying goodbye. In fact, they were saying goodbye, and they were crying while they were saying goodbye. And with that, the baby, heart started to beat. Then finally, half an hour later, the doctor came, and he was blown away to see that this baby was actually alive.
Yes. So kangaroo mother care is absolutely amazing. And I would advise it to not only for premature babies, for normal term babies, it is very good for bonding. I think we spoke about the importance of bonding
the first
couple of days, and kangaroo mother care is a fantastic way of bonding. And personally, I did it with my baby, and it's kangaroo father care, and I do it with most of my dads who I attend the deliveries with, especially with cesarean sections where mum is still recovering or is still in theatre and baby is born. Then dad is there, and dad is an absolute great person, or it's a great opportunity for dad to bond with the baby and do kangaroo father care, KFC, as you might say. But It's fantastic, and baby gets to learn dad's scent and dad's smell and dad's touch, and dad's voice is very, very resonating and comforting to baby.
Absolutely. So definitely promoting
Skin to skin.
Skin to skin. As we know, that's where baby came from anyway.
Yes.
So keeping a little one close to your heart. We need to take a short break. Stay with us as we continue conversation on your premature baby. Back in a moment. Assalamu alaikum, welcome back. A very good day to you joining us in this edition of Pregnancy to Parenting. We're talking about your premature baby, the preemies. They're so tiny, and let me tell you, I've seen some real life stories of babies being born sometimes just over a kilo. And today you look at them, they're big, strong adults, so they're absolute survivors. Tell us your story on our Facebook page. Welcome back, Dr. Lachman, and I think there's proof of that as well.
Yes, as medical science advances, we are bringing more and more premature babies through with very minimal side effects or complications or comorbidities, and there's stories of 1 kilogram babies, there's stories of 500-gram babies. You know, as medical science advances, we're getting better and better.
Great stuff. So we spoke before the break of KMC and KFC, kangaroo mother care and kangaroo father care. Yes. Skin to skin with a premature baby or full-term baby, it's absolutely imperative.
Yes.
Skin to skin. So a big life, a larger amount of the time just after birth is spent in that neonatal ICU. The baby doesn't even know he or she has been there, yes. But for mom and dad, it's a very special place to go to after baby has born. Sometimes you just like, I've got to go back to the ICU. So talk to us about the sort of vital roles parents can play in the neonatal ICU.
Okay, so the neonatal ICU can be quite daunting to a newborn or new parent, and seeing their baby on these monitors can be quite scary. So the neonatal ICU staff is a very friendly staff, and they very much understand this, that it is a new setting to the mom, and they're very supportive towards that. A neonatal ICU sister is very, very experienced and will provide a lot of support and comfort to a newborn mom. The main role of a parent in the first couple of days for a child that's in the neonatal ICU, the main role for the mom is breast milk and feeding. So that is the mom's role. I always mention it to the mom that for premature baby, the best milk for the baby is breast milk, and that is her job. And that is what she needs to concentrate on. And because baby is now not latching on, she needs to express the milk in order for us to feed the baby either with a cup or with a nasogastric tube. So it is her breast milk that is going to be fed through that tube, and that's pretty much her job. The rest of all the other things, the pediatrician and the neonatal sister will be looking after. Mum's main role is the provision of the breast milk.
Usually
expressed breast milk,
and fed intravenously to baby.
Not intravenously, nasogastrically. So via a nasogastric tube down to the stomach, or if they are fine, with cup feeding. So that is the very important role of the mom, and the very important role of the dad is to be the runner between the NICU and the mom to provide this breast milk. So he must, go to the mom, get the milk, bring it to the ICU, give it to the sister, and that sort of thing. When mom is mobile, she goes to the neonatal ICU and she spends time in the neonatal ICU. They can put the baby onto the mom's skin and do skin to skin contact with the mom even with the child on respiratory support systems. So while the child is on the CPAP driver, he can be on the mum for a couple of days, for a couple of hours, sorry, depending on how stable or unstable the child is. And the same goes for the dad. You know, the dad can spend as much time in the neonatal ICU with skin-to-skin contact, so that the baby is in a familiar environment.
Okay, you've mentioned the support staff of the neonatal ICU, and I think it was season 1 or 2 that I interviewed a neonatal nurse. They really do play a vital role.
They play a vital role in the care and the management of a premature baby, and they are very experienced. They are extremely experienced sisters to manage these premature babies. They have managed, most of them have managed many premature babies before your baby, so they really know what they're doing, and they pick up the complications very quickly and very early, and they spend most of the time with your baby. The doctor, yes, comes in for rounds in the morning and possibly in the afternoon, but it is mainly the neonatal ICU sisters who spend time with the babies, and they're very experienced. They give a lot of support, a lot of comfort to the mums. Feel free to ask them any question, and they're there to make your life comfortable. They're strict, they're very strict sisters, and it is all in the interest of the child. So if they say no visitors or please wash your hands, it is all to prevent infection to the child.
Absolutely. So a big issue around prim babies that I've picked up just Googling it and chatting to professionals and moms was this assistance they need to breathe, with breathing. Talk to us about that. You've mentioned earlier on the CPAP and
so one of the main complications for a premature baby is the inability to breathe on their own. Premature babies, as I mentioned earlier, the respiratory system is the last system to mature while in the womb, and is almost completely mature only after 34 weeks. So while the other systems tend to mature a little bit earlier, the respiratory system takes the longest in the womb. So a baby that's born less than 34 weeks will most likely have respiratory complications and will need respiratory support. They have a condition called hyaline membrane disease, where they lack what is called surfactant within their lungs. Surfactant is a substance that is found in the lungs, which allows the lungs to expand after every breath. After every breath, the lung collapses, and then when the baby takes a breath, it expands again. And with the lack of surfactant, it is very hard for that lung to expand again after each breath. And because of the lack of surfactant, they suffer from these respiratory complications. Now, usually a baby that is born before 34 weeks of gestation, and if the doctor picks up that yes, the baby is having respiratory complications, most likely due to the lack of the surfactant, then the doctor will administer surfactant to the baby, and that is when the doctor puts a tube directly into the lung and gives him the medicine called surfactant into his lung in order to allow the baby to breathe easier. It's a procedure that takes about 5 to 10 minutes but is life-saving. So after that, the baby will be placed on a CPAP driver, and the CPAP helps the baby to expand the lungs or open the lung after every breath. So if you think about a balloon and how hard it is to blow the balloon in the initial stage, and then it becomes easier, and when that balloon deflates again, it is hard again to blow it. The CPAP driver keeps the balloon open at the end of expiration, and when it needs to inflate again with inspiration, it's much more easier. So that's pretty much how a CPAP driver works, and the support that it gives to these premature babies to help them expand their lungs with each inspiration.
So we've chatted about feeding. This is a big thing during premature babies, as you mentioned. Breast milk is the best.
Yes. So that's the next system that we encounter complications with, and where the baby was in utero and was getting most of his nutrients via the placenta. The baby now is on the outside world and the gut needs to learn how to digest food. The gut was not prepared to digest food at 28 weeks. It was still developing. It was still supposed to receive its nutrients via the placenta. So feeding is quite an issue with the preterm baby, and we need to go very carefully with the feeding because of a condition called necrotizing enterocolitis. It's a big word. We abbreviate it to NEC, and we try and prevent this by being very careful with the feeding. We often start with 1 ml every 2 hours, and then we proceed to 2 mls, 3 mls as the baby tolerates it, and every day we come and we increase it 4 mls, 5 mls, and until we see that the baby has tolerated that feed, and then we increase it further. And the best milk for those prem babies is breast milk, and I can go as far as to say the only milk for these babies are breast milk. And sometimes when they are very premature and the mum does not have breast milk, then we need to look at donor breast milk for these babies, because you know, breast milk is the best milk for these babies.
Are there any confusion issues with regards to latching on and sucking? And I know you've mentioned babies still meant to be in mommy's womb at that time.
Yes.
So let's talk about now baby is out, and the first thing that they usually do is latch baby on mom's breast. Are there any confusion?
Yes, so a premature baby will not be able to latch on properly because the muscles around the mouth, you know, have not developed. It's not developed so well, and he will learn how to latch, you know, as he grows, picks up weight and develops. So in the meantime, we usually feed the baby via a nasogastric tube. If the baby is able to tolerate cup feeds, then we feed the baby via a cup. A cup feed allows the baby to swallow the food. It doesn't need any bit of suckling. It just needs an intact swallowing mechanism, and when the baby does have that, then we feed the baby with cup feeds.
Okay. We have to take a break, and it comes the big question of taking baby home after those many weeks within the neonatal ICU, and all the care that needs to be considered when taking this prem baby, as we know baby was probably still going to be in the womb. Yes. We talk more about that just after the short break, so stay with us. Welcome back. This is Pregnancy to Parenting, and we're talking about your premature baby. I'm Hawa Solomon. Shukran for staying with us, and this is as important as your newborn show that we did a few weeks back with Dr. Lachman. He is back with us talking about your premature baby. Please do interact with us on our Facebook page, Pregnancy to Parenting. So we want to try and get as much information out of the segment. Time really goes quickly. Yes. And I want to now focus on taking baby home, not just preparing the home or the environment or the car seat, but also what mom and dad needs to know before baby can be discharged and how important that is as well.
Okay. All right. So so when baby is ready to go home, obviously the doctor and the neonatal staff will be happy that the baby is comfortable and mature enough and is at a weight that is sufficient to go home. Okay. Usually that is around 1.8 to 2 kilograms. Sure. So if your baby was born 1 kg, you know, you'd have to wait until baby has picked up to that weight where they would be allowed to be discharged. Yes, it's very tiny, and it's still very small. Before they are discharged, the doctor will make sure that the child is feeding properly and that the mother is comfortable with feeding. with whichever method that has been chosen to feed the baby, whether it is cup feeds or bottle feeds or breastfeeding, latching on. So before the baby is ready to be discharged, they will make sure that the baby and the mum is very comfortable with the feeding routine. So even if the baby was ready for discharge 2 days ago, they'll rather keep the baby 2 days longer and make sure that mum is comfortable with the whole routine and that she is fine with the feeding and that baby is latching on quite well, or feeding with the cup quite well. The doctor will also make sure that the baby is infection free and does not have any neonatal jaundice or any other complications that we have seen in the premature baby, and that is breathing properly and maintaining his oxygenation in room air, does not need any support. The other important thing that we mentioned was the temperature, and it will also be monitored that the baby is maintaining his temperature in a cot in the hospital rather than being in the incubator. So it will be a day or two after they come out of the incubators, they will be put into cots and their temperature will be monitored to see that they are able to maintain their temperature out of an incubator. So these are all checklists that need to be checked before baby has been given the green light to go home. Now, during that time, in the neonatal ICU, the mum would have received quite a lot of support. She would have received a lot of support with regard to nappy changing, feeding structure, umbilical cord care, etc. All that, a normal term
Bathing
baby.
that tiny little one.
Bathing the tiny little baby. She would have received a lot of support from the neonatal sister, and usually the mums are quite emancipated and they are quite ready at that stage. They've spent a long time in the ICU, so they are ready to take this baby home. When the baby goes home, it is best that they try and maintain the similar routine and similar environment that was created in the neonatal ICU. Keeping the baby in a nice warm room, warm environment, away from the window, away from drafts, and the feeding routine remains the same. It is very important for the parents to pay attention to hygiene and have a strict hand washing protocol at home before handling the baby, and having a hand sanitizer close to the baby's bed so that every time anybody who picks the baby up sanitizes their hand, and we prevent transmission of any infections. The parents should maintain a similar, what I usually advise them, a similar environment as the hospital. So, limit the amount of visitors and the amount of guests that are handling this baby. A premature baby's immune system is still very much developing. So, they are very prone to develop infections or pick up infections easily. So limit the amount of visitors and visiting with the baby, until the baby is bigger, at a much more sufficient weight and age. Yes, and those are pretty much some of the things that...
So that's a special care that parents need to know when they're taking baby home.
Yes, and then the other thing that I tend to advocate to, not only to premature baby parents, but to most parents, is that at some stage they should do a first aid course, just to empower themselves should something happen that, that is unforeseen, and so they feel empowered. And I encourage this both with the term babies and the preterm babies' mums, so that you feel empowered as to manage a situation if it goes wrong.
I think what I picked up importantly when discovering the newborn development, and as you've mentioned earlier on, they still need to be considered as if they and kind of counted as if they were born when they were meant to, as in term retrospect.
Not according to their chronological age.
Yes, there we go. Yes. So looking at baby and their stages of development and their growth compared
Yes,
to
so their growth
full-term?
does not correspond with the chronological age of baby, meaning that, baby was born today and in a month's time will be a month old,
Yeah.
but actually will only be 32 weeks if the baby was
Yeah.
in the womb.
Yeah.
So we usually correct the chronological age according to the preterm, how preterm they were, and then we put them on par to that. So for example, if the baby was born at 34 weeks, that is 6 weeks premature, then when the baby comes for the 3-month checkup, we will subtract 6 weeks and see, okay, so this baby should be on par with a 1.5-month-old baby, and that's how we follow them up. They usually catch up with regard to development and growth by the age of 2 years. So usually they are on par with their peers, and definitely by the age of 5, premature babies should be on par with their peers. And that is an important age for school going, where they perform just as well as their term peers.
Because I mentioned earlier, and I've seen pictures of very preterm babies.
Yes.
And a later picture of 5 years later, and this kid doesn't even look like...
Yes, and the more advanced medical science gets, the smaller that gap becomes between a premature baby and a term baby.
So a big thing is also around the emotional state of the parents, and especially the mom. Is there any support that is out there? And you spoke about the neonatal ICU sisters and the nurses that are there, but is there any support base provided to families and infants, of these infants?
Yes, there's lots of support groups. There's lots of support groups of mums of premature babies. Very important is your pediatrician. Your pediatrician or neonatologist is your first port of call, your first pillar of strength, and your soundboard that you bounce any question off or any concerns of to that person. So yes, forms a very important support structure when managing a premature baby. And then yes, the neonatal staff and the neonatal sisters. As we've mentioned before, the mums spend 2 months, 3 months in the neonatal ICU. They become very friendly to the neonatal staff. They get to know them very well. And even when baby goes home, often the mum phones the neonatal sister to ask her for advice, because they've developed a relationship with them. And then yes, at Well Baby clinics, there are lots of support groups and organizations that support mums for premature babies.
Should parents of premature babies maybe keep a development diary, a daily diary? Should there be
it should be a daily diary, but a premature baby requires much more follow-up than a term baby, and much more or more regular follow-ups with their pediatrician to see that the development is on par with regard to the neurological development. And that, as we spoke about in the earlier segments, divided into the motor development, the fine motor, gross motor, speech, hearing. All of that needs to be checked that it is on par, and if there are any issues, to get interventions in place as early as possible. We
literally have 2 minutes to wrap up, so in conclusion, I'm going to pop a question that has come from our viewers as well. Is that although that we know some of prim babies are really skinny, they're quite furry. They have a lot of hair on them. Just explain what that phenomenon.
So they have what is called lanugo hair. It is hair that is, the prim babies have and will shed it in time. It is completely normal and natural, and their skin is also very transparent, and their skin is still developing, so that is part of the, a premature baby, and in time it will develop into a term baby skin.
In conclusion, Dr. Latchman, thank you so much for your time. And at the end of the day, we still have to give the same sort of love and care and special skin-to-skin care to these little ones. Your last comments on premature babies?
Yes, we are doing very well with premature babies. Mums should not be too scared when they have a premature baby. Medical science has advanced quite significantly. We pulled through very, very premature babies with very minimal comorbidities. And yes, I'll end off with skin to skin. It's very important, and it's very important to prem and term babies.
So what comes out here for premature baby in this show is kangaroo mother care and kangaroo father care, KMC, kangaroo care. So go and research it, whether it is that you have given birth to a newborn baby or a premature baby or a very prim baby or even a full-term baby. Very important, kangaroo care. Thank you so much, Dr. Rabin Najman, in studio pediatrician. Always a pleasure chatting to you, and have a good day.
Thanks.
So please do catch the repeat of the show on Saturday mornings as well at 10 a.m. and you can view it live via live stream on itvnetworks.tv. From myself, Hawa Solomon, enjoy the rest of your day. Wassalamu alaikum.